I'm Alex,
And I am Carol.
and we're going to do a respiratory assessment on our client, Richard. Come in.
Hello, Richard. I'm Carol, and I'm a nursing student at Minneapolis College. I'm here to do a respiratory assessment, and I just got some questions for you. And it's just to get some assessment data. Have you ever smoked or do you smoke?
No, I'm not a smoker.
Good. Do you have any family history of asthma?
No.
Have you ever had like a cold or pneumonia recently?
No, I've been feeling okay.
Are you up to date with your flu seasonal shots?
Yes, I got my flu shot in the fall.
Good. And how often do you do physical activity?
I like to run on the weekends.
Good. Okay, I got all of that. So now we're just gonna get started. Is it okay if I raise your bed a little?
Yes.
Okay. And I'm just gonna elevate the head of the bed a little so we can do an inspection of your anterior and posterior thorax or chest.
Okay.
Okay. Just gonna wipe this real quick. And we're ready to begin. Okay for you if I just pull this down so that I can inspect your chest?
Yes, that's okay.
Okay. Good.
I got it.
Thank you. When you guys are ready, we're going to do that. All right. Okay. So once the client is sitting up, what we're going to check is the chest cavity. We want to make sure we observe any abnormalities. We also want to inspect for the breathing rate, the breathing rhythm, the depth, and the effort. And also here, what we're gonna do is we're gonna just get the breaths per minute, and we can just write that down. Okay, and so what we're gonna do here is we're gonna check for coloration, if we find any masses or lesions, or anything that doesn't look right. And if we do find something, we're gonna proceed and ask more assessment questions, collect as much data as we can, and see what's happening. We're gonna do this with the anterior part and the posterior part as well.
Next, we will palpate, and we will be looking for any tenderness, masses, or lesions. And be checking in a zigzag pattern across the chest. And then we repeat on the posterior aspect of the back of the chest. Okay. And then we ask the patient to repeat the phrase 99 and feel in multiple spots for vibrations. For 99. Then we check for chest expansion by holding our, oh, this is hard. By holding our thumbs along the spine and asking for them to take a deep breath and checking to see how far apart our thumbs come apart and make sure that that is appropriate. Okay. Next, we will auscultate the lung sounds. We are looking for vesicular sounds or normal lung sounds. We are looking for crackles, either fine or coarse. And bronchi. Or wheezing. So then we start by listening above the clavicle on each side for at least one full breath. And then below the clavicle for one full breath. And then we move down an inch each time. And we're comparing each lung to the other in each section. Then we repeat on the back.
Okay, so next we're gonna auscultate the posterior part, and we're gonna listen to the top of the lungs in each side. And while we're doing this, we're asking the patient to take deep breaths, and then we go down by an inch. So the patient seems to be breathing normal, regular normal sounds, and they are both bilateral. And when we get to this part, we just wanna listen to the exterior part of the lungs too. Okay.
Yep.
Okay, so our last recommendations are just to tell our client to avoid smoke, or not to smoke, or smoke environments, polluted environments. And also we would recommend to do at least 30 minutes of physical activity per day.
And any abnormal findings, we would want to classify and report to the medical provider, the primary care provider.